Although pregnancy is an interesting period, every pregnant woman should be aware of the possible problems. In today's video, we're going to break down the top 10 pregnancy issues, why they happen, how to detect the indications, and most importantly, how to prevent them, with some simple expert tips along the way. Before we move on, we'd love for you to subscribe. Feel free to share this video with your family and friends who might find it beneficial who haven't had the opportunity to see a doctor. Let's start now. From the most common to the rare among pregnant women, every woman has different pregnancy problems, hence, all must be watched out for. Number 1. Anemia during pregnancy. Anemia results from your body's lack of red blood cells to supply oxygen to your baby and tissues. This is typical of pregnancy since your blood volume rises, and so increases demand for iron. Signs include pale skin, vertigo, and tiredness. Usually it is found by standard blood tests. Pay close attention to iron-rich meals including beans, lean meats, and spinach to help prevent anemia. Crucial are prenatal vitamins high in iron and folic acid. To maximize absorption, pair foods high in iron with sources of vitamin C like oranges. Number 2. Urinary tract infections, UTIs. UTIs are common in pregnancy because of hormonal changes that relax the urinary tract, so facilitating bacterial growth. Symptoms include pain during urination, frequent urges to go, and unclear urine. Staying hydrated, practicing excellent hygiene, and avoiding holding in your urine will help to prevent UTIs. Pro tip: cranberry juice can support urinary tract health. Number 3. Gestational diabetes mellitus, GDM. Gestational diabetes results from insufficient insulin produced by your body to control blood sugar during pregnancy. It is driven by placenta-generated hormones. Although they are generally minor, signs include tiredness, frequent urination, and too great thirst. Usually found with a glucose tolerance test at 24 weeks is it. Eat a balanced diet, keep a good weight, and stay active to prevent GDM. To assist naturally control blood sugar, pay particular attention to whole grains and high-fiber diets. Number 4. Preterm labor. Preterm labor happens before 37 weeks and can be triggered by infections, multiple pregnancies, or uterine anomalies. Among the signs include consistent contractions, lower back discomfort, and changes in vaginal discharge. Get regular prenatal care, avoid smoking, control infections, and prevent preterm labor. Pro tip: keep hydrated. Dehydration might cause constriction. Number 5. Gestational hypertension. Gestational hypertension is high blood pressure brought on following 20 weeks of pregnancy. It can follow from changes in hormones and higher blood volume. Among the symptoms include headaches and elevated blood pressure readings. Exercise often, cut back on salt, and control stress to help avoid gestational hypertension. Pro tip: track your blood pressure at home to find early on changes. Number 6. Preeclampsia. Preeclampsia is a major complication whereby, mainly affecting the kidneys and liver, high blood pressure and indicators of organ damage arise following 20 weeks. Though its exact origin is unknown, aberrant placental development is related to it. Among the signs are severe headaches, vision changes, swelling, and raised blood pressure. Eat a good diet and control your blood pressure to lower your risk. Calcium supplements have been demonstrated in certain women to help reduce their risk of preeclampsia. Number 7. Hyperemesis gravidarum, HG. Hyperemesis gravidarum is pregnancy-related extreme nausea and vomiting. It relates to increased HCG hormone levels, particularly in the first trimester. Among the symptoms include weight loss, dehydration, and severe nausea. Eat little, frequent meals, and keep hydrated to help control it. Infusion fluid could be required in extreme situations. Pro tip: vitamin B6 and ginger help ease nausea. Number 8. Pregnancy's tachycardia. Tachycardia is the condition whereby your heart rate rises to above 100 beats per minute. This disorder can result from your heart having to pump extra blood to support the developing baby during pregnancy. Among the symptoms include palpitations, vertigo, and dyspnea. Stay hydrated, get lots of sleep, manage tachycardia by avoiding caffeine. Deep breathing techniques can help calm down palpitations and lower heart rate. Number 9. Amniotic fluid abnormalities. Development of your baby depends on amniotic fluid, both too much and too little fluid, polyhydramnios, as well as abnormalities can indicate underlying disorders such as gestational diabetes or placental problems can lead to these. For polyhydramnios, signs include a rapid increase in uterine size. For oligohydramnios, slow fetal growth. The greatest approach to find fluid issues early on is with frequent prenatal checkups and ultrasounds. Pro tip: maintaining good amniotic fluid levels depends on keeping well hydrated. Number 10. Placenta previa. Placenta previa is the condition whereby the placenta covers the cervix, so preventing the baby's exit path. It results from aberrant placental implantation. Usually diagnosed by ultrasonic means, signs include painless vaginal bleeding in the second or third trimester. Although it's not always possible to prevent placenta previa, early identification can be achieved by avoiding smoking and showing attendance to all prenatal visits. Resting and avoiding heavy lifting can help to lower the bleeding risk. A successful pregnancy depends on one knowing these issues and how to avoid them. All the difference is in regular visits, a balanced diet, and some basic lifestyle adjustments. Remember to subscribe and ring the alert bell for further pregnancy information and health recommendations.